So welcome everyone to our session today for residents and researchers. If you're calling in, you probably know today's topic is From Rooftop to Mercado, How CHASS Cultivates Food Access in a Healthcare Setting. So we're going to hand it off shortly to Dr. Bryce, our speaker, but I'm just going to introduce myself and this series. So my name is Natalie Sampson. I lead the Community Engagement Core for the Michigan Center on Life Stage Environmental Exposures and Disease, which most folks know as the M-LEEaD Center, and we're supported by the National Institute for Environmental Health Sciences through a P30 grant. And I just want to give a shout out to our stakeholder action board that is comprised of grassroots leaders, community leaders, local and state leaders in public health and environmental health that we're really appreciative of setting our priorities. So in the M-LEEaD Center, our job is really to make sure that we're learning about what's happening on the ground. We're communicating with researchers, we're communicating with policymakers, and making those pathways easier so that we can translate some of the research into action and make sure that we're improving health for folks. So we have a whole series of residents and researchers we'll put in the chat for folks who want to watch some of the other past videos on a variety of topics. We've covered air quality, wildfires, healthcare waste, water affordability, climate and housing. The list goes on, so we'll let you check those out. So as we get going, please feel free. We're going to spend about 35 minutes hearing from Dr. Bryce, but please use the Q&A or send comments in the chat, and I will track on those so we have time at the end for a little bit of a discussion. So yeah, here's who we have today. I'll talk about a little bit, and then I'll hand off. So Dr. Richard Bryce is a family physician and the chief medical officer at the CHASS Center. He's also faculty advisor for the Street Medicine Detroit and Detroit Street Care Program, which is a student organization at Wayne State School of Medicine and Michigan State University College of Osteopathic Medicine. And then I'll just briefly talk about CHASS, although I bet Dr. Bryce will a lot. It's just really important to mention, I think, the history of CHASS, who's been a longtime partner with many of us researchers at the School of Public Health. CHASS was established over 55 years ago in response to the closing of several community hospitals in Southwest Detroit and the subsequent flight of medical professionals to suburban practices. In 1970, Hispanic leaders negotiated the first ever joint venture with local and state public health officials, and CHASS began providing limited medical services to the uninsured and underinsured populations of Detroit. And it has just remained such an important part of the region, and just amazing work that you all do there. So I'm really excited, and everyone on the call today, I'm sure, is too, to hear all about the work you're doing. So I'll hand it off to you, Dr. Bryce, but please, everyone, feel free to use those chat and QA functions so we can ask some questions later.
Thank you so much, Natalie. Thanks to Natalie, Robin, and Meredith as well for setting this up and being on me. Once again, I know some of you saw last month I had was missing, and so I appreciate the chance to come back and really share some of the awesome work that's happening at CHASS. So I'm going to share my screen right now. Just have a few slides with some fun pictures for everybody to kind of check out. And so let me increase that. Oh, actually, sorry about that. And so I think some of the work at CHASS is really exciting. So as you can hear, we have this idea of the rooftop to Mercado. And so kind of what the focus is going to be today is I want to give you a little bit more details about what CHASS is and what we do, and a little bit more about being a federally qualified health center, and then really looking at some of these unique programs that we have done, especially when we're thinking about food access, addressing a community need, whether that's in terms of food insecurity or education, and some of the unique programs that we've kind of been able to put in place for pediatric patients, for adults, for the entire community. And so really excited to kind of share that with you today. So a little bit about CHASS. So you can see this, who we are. This is the Southwest Center, which has been around for 55 years. We do have a second center, which is part of the Pope Francis Bridging Housing Complex, which is just a little bit north of where we are now. And so a little bit of different patient populations. Obviously, Southwest Detroit really is part of, a large immigrant population, many from Mexico, Central America, South America, as well as the diversity that comes with Detroit in itself. And then our other site definitely focuses, especially being part of the Bridging Housing Complex, where the Pope Francis Center has a transitional housing unit, many people that are dealing with homelessness, and other, social determinants that play a role there. But there's definitely overlap at both of the centers, and I think you'll get to hear a little bit more about that today. But You can see in terms of our vision, we believe in quality healthcare is a basic human right delivered through access and equity for all. CHASS Center is committed to the well-being of our community by promoting and providing accessible, comprehensive, affordable, and inclusive quality patient care, right? And supportive services that you will hear about today. So just want to make sure people know what an FQHC is. So, because obviously I think there's multiple federally qualified health centers and community health centers within the city of Detroit, and as well as across the state of Michigan. But I think some of the things that make us a little bit unique is that we really have to be able to see anybody that comes to see us, right? So whether you have insurance or you don't have insurance, whether you speak English or you don't, whether you have a bill or you don't, we have to be able to allow people to come into our clinic, which is really important. Now, it's not considered a free clinic. It is a sliding scale. So based on your income does allow you to understand kind of the what you will be billed. But, in terms of allowing us to give access is key. And of course, we provide, multiple different services, medical services, dental services, mental health. We definitely provide a lot of transportation and then have connection to hospital care as well. And so I think this is really important to understand of who we are as an FQHC. Now, when we talk about CHASS, if you look at kind of the demographics, which make us unique, even in terms of the FQHC space, you can see even before the Affordable Care Act, now we're 10 plus years ago, 86% of our patients at that time were uninsured. And you can imagine that comes with some unique challenges. Fortunately, with the Affordable Care Act, that's played a huge role in terms of increasing the amount of patients that we have that insurance, specifically Medicaid, as you can see. And so for us right now, 39% of our patients are uninsured, 45% have Medicaid. And so this is the patient population in terms of payer mix that we have to deal with. We do have some private insurance as well. And of course, Medicare also fills in those other gaps. Definitely diversity in terms of our patient population. In terms of the Southwest site, we're talking about pediatrics, a large pediatric population, definitely a large population in the Southwest site that prefers Spanish over English, and then a large population of patients that are dealing with poverty, as you can see in that bottom demographic. But I think one of the things is, though, if you understand CHASS, CHASS has been around for just a little over 55 years. And as was stated before, really came together as a grassroots organization. Because if you think back 55 years ago in the city of Detroit, you're saying, the city had close to 1.8 million people. And as people started to leave the city, doctors left the city, hospitals left the city. And so the community came together and said, we really need to have a place for our patients to come. And so that's been key. But I think a lot of the community decisions or the decisions of the clinic have really been a reflection of what's been needed in the community. So it's not just been about healthcare, but as you can see, we're more than a health clinic. So we have dentistry, as I said, pharmacy, we have social work, we use nutrition education and nutrition help. We have our REACH group, which is part of an awesome grant going back many years ago with the Detroit URC of a CBPR model really allowed us to give diabetic support for our patient population, and that has evolved over time. LaVita is another grant-funded program that continues, that does a lot of intimate partner violence support. We have a community center that's here, a farmer's market. We also do street medicine that was mentioned before. And we're going to talk about some of those unique programs that has really come out as talking with our patients and talking with the community of what's needed to help make a better impact on the community's health. So these are just kind of some of the other things, just adding on. I mentioned the LaVita. We do a lot of opioid use disorder treatment as well. We have behavioral health, and then cooking classes, Zumba, the Mercado, which we're going to talk about, a fresh prescription. We have a CHASS 5K every year, really encouraging exercise to our patients. And so we'll talk more about that as well. So let's talk about some of these unique programs, especially in terms of kind of food, which I think is really exciting. And so one thing that we've had at CHASS, going back about 12 years now, is our Mercado. So every Thursday throughout the summer, usually starts like the first week of June, all the way through mid to end of October. In partnership with Eastern Market and many other organizations, we've had this awesome Mercado. And it's just continued to grow and been such an impact for our community, which is awesome. So you can definitely get get some fresh produce that's there. But we've really allowed other vendors to come in from the community to connect. And then we also do a lot of education that's there. Now, you can see as well, there's a logo for our fresh prescription program. This is another really incredible program that we've had going back that same time. This was a model of this idea of prescribing fruits and vegetables to our patients. Started off with the Washtenaw County program and then kind of adapted to us. It initially was called the Health RX program, and then now has been the Fresh RX program for many years. And for myself, what that means is that I can prescribe fruits and vegetables to my patients, which is awesome. And I can tell you for many of our patients, that is a huge benefit when you're dealing with things like food insecurity, and really emphasizing the importance of connecting food and nutrition to your health, which is so, so important. And so you can see here, this is kind of just a flyer of, who we are in partnership with, and who comes to the market as well. This was just from this year. You can see it started. It's in Thursdays, and it goes. This was for just this past September 25th. Of course, it's in Spanish for many of our patients, trying to make sure that they can have connections. And this just shows the different people that are there. We've had food trucks, and this was a taco truck that was there that day. And then other organizations try to come and, share health information about their organization, as you can see here as well. And here's just some great pictures, as you can see, of, whether it's getting yourself a coffee, same thing, many, many activities, especially oftentimes focus on nutrition, especially for kids, really encouraging healthy, nutritious habits come from the CHASS Mercado, as you can see there as well. And this just kind of gives you an overall view. That's the front entrance to the CHASS Center. And so just an idea of things that are there. And we have a lot of our team is doing some education, some of our community health workers, as well as our nutritionists that are there as well, really trying to make the connection and encouraging individuals to come to the market. And it's definitely very busy throughout the summer. So I want to dive a little bit more into this fresh prescription program, which has been a pretty big benefit for us. And so the model has changed over years many times, is in terms of how can I prescribe fruits and vegetables to patients is very much relative to the funding that we get. And so fortunately, we have had some consistency in terms of grant funding, although the funders have changed over the years as well. And I can tell you for us, like this was a model from, I think, 5 or 6 years ago, and same thing, markets every Thursday from June and through October. And patients could get $10 a week on a debit card that they could come use at the market for fresh fruits and vegetables, and could get that up to $80 or 8 times per week. And then there actually was some opportunities to set it up again if they needed more as well. And so obviously this is an awesome program. The inclusion criteria of who's eligible kind of has changed over the years as well, based on funding and how many people that we can use, especially connecting with insurance companies. But one of the interesting stories for us goes back to the idea of we had this great funding the first couple of years, and we ended up that first funder and allowed myself to prescribe fruits and vegetables to every patient. So anytime a patient was coming in, I'd offer it to them, and many times they would accept and be able to really get that benefit. However, after a couple years of that first big funder, they were like, we're going in a different direction. And so I had already started to see the benefits of a program like this and wanted to keep it going, and realized that we needed to find a new funder. And so we started talking to other funders, and a lot of funders would be like, that seems like a great idea, but what does it actually do? And I have to be honest, I wasn't much of a researcher before that. I'm not sure I would consider myself a researcher now, but knew I needed to get some support and some help. And so that's what we did. So we started kind of trying to figure out who benefits the most from this program. Started off with some retrospective reviews of kind of patients, started to realize that patients experiencing diabetes seem to have, some benefits in terms of outcomes later on. And so if you look at, these are some of the things that we published over the years. If you look on the right side, this was just a pre and post analysis of kind of biometric health data. So A1C, hemoglobin A1C, their blood pressure, as well as weight in patients experiencing diabetes. And we saw this statistically significant decrease. Now, I knew there was lots of confounders. And so if you look at the study on the left, this was looking at a randomized control trial that we put together. And so had a control group and had an experimental group, which was our fresh prescription group. And, we kind of found that same data, which was really interesting. And so if you look here, this is the orange line represents the control group. And you can see these are, for those of you that aren't familiar with the hemoglobin A1C, A1C tests, we would say those that are, you're diagnosed with diabetes if your number is greater than 6.5. Your goal typically is about 7 is what we want. And you can see many of our patients that were enrolled had high A1Cs. And so, but if you look at that orange line, there really wasn't very much change. If you look at the blue line, that does represent our fresh prescription group. And so we saw that there was a statistically significant decrease in their hemoglobin A1C for our participation in a program like the fresh prescription. And so really seeing benefits. Now, do I think it's just the food? Probably not just the food. I think there's lots of other factors that play a role. There's education that comes with this type of program. And then we also know that we are dealing with a patient that, has higher rates of poverty. And so, we know that you're going to reach towards cheaper things to eat for nourishment. And so if we're just able to give people fruits and vegetables, could that make a difference? And so we were pretty proud of these findings, and that's allowed us to kind of continue to advocate to get more grant funding, and then even be a part of like Farm Bill from 5 or 6 years ago, like that we're able to write in, more funding for programs like this. And so excited to see where this kind of goes forward, and we'll talk a little bit more about that. One other thing I did want to bring up is that we were able to do kind of a cost benefit analysis on this as well. And so you can see that the average incremental cost of the fresh prescription was only $126 per 1 unit reduction in hemoglobin A1C for the fresh prescription arm compared to the control arm. So not that expensive, especially in a program like this. And when we advocate, as I mentioned, for the Farm Bill, like we don't think that this should be grant funded or this should be in a Farm Bill. There should be insurance companies, because if you think about insurance companies, they're willing to pay for many medications that lower blood sugar in patients experiencing diabetes, may come with healthy food. And so continuing to do the best that we can there for sure. So other things that we've noticed, one thing that you saw earlier in the slide is that, we have about 40% of patients that are uninsured. And so, we don't take, it doesn't matter to us, as I said before, what country you come from or what language you speak, but we do also know that there are challenges of people. Let me see if I stop.
Oh, there we go.
Back. Did I just freeze?
You're back.
Sorry about that.
Yeah,
All right,
no
cool.
worries, no worries. We gotcha.
All right, cool. Looks like I should be all right. Let me get back on here. All right, so going back, so sorry about that. If we go to the food, we've really put some emphasis in food distribution, because I know many of our patients don't qualify for government subsidies for food, especially like in times when things are rough, right? Economy's having some challenges right now. If you go back to COVID, if you remember, there was kind of the stay-at-home order, and so a lot of our people that were just, working random jobs and weren't eligible for government benefits or unemployment really needed help. And so you can see we had like a line all the way down 4th Street, very, very far for people just trying to get food boxes. And we've kind of continued that momentum going forward, understanding that food insecurity is a challenge for many of our patients, and just want to make sure that they have access to food and how important that is to their health. Excellent. So another really exciting thing that we have at CHASS is our demonstration kitchen. And so you can see this was one of our cooking classes that we had with some kids, but in the background shows that kitchen. And if you look on the top, there's kind of a white thing that hangs down. That's a camera. So there actually is connected. So if we have a large conference room right out here. So if we have to have cameras and TVs that people can see a little bit closer to the demonstrations, we are eligible and able to do that, which is excellent. And so you can see some of the cool cooking classes that we've had over the years. You can see one here was like a 21-day health kickstart, which really emphasized like a whole food plant-based diet, which was really, really great. And then same thing, we've worked with lots of different organizations in terms of like Cooking Matters is the program. You can see it's in Spanish, but that's our Cooking Matters program in terms of educating people by using that demonstration our demonstration kitchen, which has been really, really excellent. And so one of the cool things that happened to us as well as, once again, emphasizing kind of these community and academic partnerships is a few years ago, we had a researcher from U of M School of Public Health that had reached out and said, you know what, I heard about this demonstration kitchen that you have, and how is that going? And interestingly enough, when we first opened our building, the building that I'm sitting in right now was open in 2012. And so that was when the cooking classes started in our demonstration kitchen. We had really good momentum, and then things kind of like subsided, and we were really struggling to kind of like create a little bit of a spark. And so Julia Wolfson, who is a researcher, actually had been a 5-star chef in Brooklyn before, and kind of one day at work decided like, hey, I'm cooking these great meals for people that are really wealthy, but what am I doing to like help other people? And so she decided to go back to school and wanted to kind of utilize her knowledge in cooking to make an impact on patients, especially through research. And so she had connected with us. What was really awesome is she came in and was like, what if we utilized some focus groups and created some more cooking classes based on those focus groups. And I was actually a little bit skeptical because we had done things like this before, but the word that was put out was great. So we created 2 focus groups. One was in Spanish, and that group kind of turned out to be mostly kind of younger mothers and women that really their goal of what they really wanted to learn more about how do I cook like Mexican food in a healthier way. So we were able to create some awesome cooking classes related to that. On the second side was, in the English side, was mostly people that were a little bit older, closer towards retirement age, and they really wanted to learn how to cook anti-inflammatory meals, which we were able to do. And so we did kind of 2 different cooking classes. The focus groups were well attended. The data that we learned from the cooking classes was just awesome. It was really, really exciting. And that's kind of created some really new momentum kind of as we go forward based on what we learned from those focus groups. And so then another really exciting thing for us is that over the last year, we also have put on our second floor of our building is we have a community garden. And so we've been able to get some funding there as well. And you can see some pictures here of some of our gardening classes that we've been able to put together, which has been great. A lot of these have been put towards kind of our youth, which they really get into, and they don't mind getting their hands dirty and planting and following up as well. And of course, watering and seeing kind of the growth and understanding kind of the garden model that we have here as well. And, one of the big dreams that we've had has been, this idea in these classes is, hey, can we plant something? A kid plants something and they're part of this. They learn the gardening skills that they need. And then when we're ready to harvest, bring it in and put this into a cooking model. And so same thing. And we've seen this. I mean, it was probably one of my most proud things of seeing kids going and picking their vegetables from the garden that they planted, and now we get to cook it, and really emphasizing like the whole cycle of planting, gardening, growing, and now able to cook, prepare, and eat, which has been really, really incredible. And so you can see this. So this was some of our family cooking classes from this past fall, which has been really great. So you can see this was Tuesdays from October through November. Had great attendance as well, lots of good momentum, and really being able to utilize some of the really, really incredible programming that we do have here at CHASS, which has been great. And so you can see, as I said, throwing you some really good pictures of some really, really cute kids chopping up some vegetables that they were able to prepare for later for food as well. Just a few more here. Yeah, and once again, cute kids help with the pictures as well. And so kind of in closing, though, I wanted to share some of our programs. We're also in a unique time right now, as you guys are all well aware of, is where does this go and where are we at? So, there have been some unique changes in our government. Some of you guys may have heard of Robert F. Kennedy, and I was just sharing a story recently that I had a chance to see him speak in Washington, D.C. a few weeks ago, and I'm not going to say much more than one thing he is really pushing, though, is this idea of food as medicine and how we can emphasize that. And I will be honest, in medical school, in terms of nutrition education, it's underwhelming to say the least, and we can absolutely do better there. And so what's exciting is I think this idea of investing more in these types of programs, because I said to you before, a lot of the funding that we do is grant funded. And so in a place like CHASS, which is an FQHC, we're talking about, the challenges that come along with, funding will cover things so far, but obviously there's usually an end date. And then so when you've hired somebody that's teaching a cooking class, when the funding is done, are we done with that class? And we've tried to extend contracts and do the best that we can, but getting more long-term sustainable funding, I think, is really, really key for us. And so he has put some proposals out so far. It hasn't really, we haven't seen much for places like CHASS. There's been bigger hospital system grants that I just saw were released last week. And so Either way, I am hopeful because I think for a place like CHASS that has seen a benefit in our patients, not only just clinically for myself when I see patients starting to make improvements in terms of their nutrition, but also we've seen this on the research side, and hoping to continue to look at connections between nutrition for our patients and how that plays a role in their health even long term. And so excited for that as well. And so we will see where this goes, but I'm hoping there is some positive momentum with some of the rhetoric that we hear, of course, coming from Washington. So with that said, just really appreciate you allowing me to come back, especially during your lunchtime. You can see this is my email. I'm hoping there was some questions in the chat that we can talk about right now. But if not, there's also, this is my email. So if anyone does have any questions, please reach out. I will leave one thing. I wanted to give a shout out to everyone as well, and knowing kind of the audience that's here, understanding the work. And, I look at a place like CHASS and the collaborations that we've had. I mentioned a few of them. But collaborations with different researchers and different organizations, I think is so key. When you're just trying to do the best you can, especially when it's coming to a vulnerable population. And so, at a place like CHASS, we couldn't do it with all the amazing people that we've worked with in the past, and are so appreciative for that, and really excited and encouraged and passionate for the future as well. So, thank you so much. And Natalie, please let me know if there was any questions in the chat.
Yeah, well, I have a million questions, but we'll start with, there is one in the chat, and
Sweet.
just thank you for sharing this important work. It's really incredible and hopeful to see all that you've all been doing for 55 years. So, and plus onward. So one question in the chat is about the connection between the Mercado and the fresh prescription program. So do you see the Mercado being where that program is implemented, or people are able to take that to other places, or does that really kind of bring a lot of folks to CHASS?
Yeah, great call. So it's a little bit of both, and I probably could have explained that a little bit better. So yeah, the Mercado is, as I said, every Thursday from June through October, and that's going to be there no matter what. The fresh prescription program, and a lot of it, it's like based on funding each year of like how much funding that we have, how many people we can enroll, and how often that they can come. And so typically what happens is the Mercado starts, and then around that same time, we are starting to recruit. And so like, and in a lot of times I can tell you of doing this for many years, like I have some patients that are asking for it every year. We also have like patients that you may see in June and like, hey, you'd be a really good one. So we can get them set up to get like more or less that prescription to get enrolled into the program. And then usually what happens after a few weeks after the Mercado starts, there's usually like an educational session for those that are part of the fresh prescription. So they kind of go through and talk about what the Mercado is going to have and what activities that are there, how they can get their debit card set up, and how they can get their fruits and vegetables, and how they can get it renewed if they need to get it renewed. And then usually what we've had as well, based on whether it's been some research or just the grant funders of like getting some demographic data, even getting some health data from individuals that are participating. And so, usually that's at the beginning when they first start, and then we kind of follow up. And usually what's happening is that if they're coming in every week, that's great. They'll connect with the community health worker that's there at the time. And then, but if they don't, or if they're not coming in, or they're unable to come in, then that community health worker is usually following up with them as well to check in. And we've even had to do some people midway through, work schedules change. They're not able to come on Thursdays. We've had food delivery services as well, and utilize that of dropping off food boxes. And so it just kind of depends based on kind of the year and the resources that we have. But really what we're trying to do is, as I said, is the Mercado's there no matter what. The fresh prescription is just on top of that to connect people once again to the idea of nutrition and health, and making sure that people are learning and emphasizing that for sure.
Fantastic. And nice. Yes, always a shout out to the community health workers that do so many amazing things behind the scenes. So building on those prescriptions, someone in the chat is also thanking you for your lovely talk, but have you ventured into the space of nature prescriptions? So greenery, nature, of having health benefits. Is that something that CHASS has talked about, or you?
Yeah, so this is a great one. So nothing that's had any funding, I can say, but I can tell you, like in terms of just like for us, like I mentioned a little bit about. So in terms of, I'll start with the nature part of this, of just like getting people outside and getting the changing kind of the habits of of our people. I think what I would say, there's kind of two ways to focus it. There's kind of like the clinician focus. And so I know that some of our providers have really emphasized this, especially in our neighborhood and understanding the neighborhood. And, it's not like we have like great greenery in some areas of Southwest Detroit, especially with many of the factories, but we do have some good parks. And so really emphasizing like going to a place like Clark Park has been really important for many of ours. And so I can say we haven't ventured enough, but I think there's definitely some opportunities that are there for sure. I'll give one other plug too. Is I mentioned this in the beginning. Is every year we've had our CHASS 5K run, walk, and kids race, and I think this connects well to that. Is that the idea of that? Crazy enough, this is our 14th year. But when we first started, there was a lot of conversations with patients about, yeah, let's get you outside. Let's do some exercise. What about just going for a walk? And the response would be like, yeah, doc, I really want to go for a walk, but my neighborhood's too dangerous, or maybe I come from Mexico or Central America or somewhere and it's too cold in the winter and I don't feel comfortable walking. And I remember kind of feeling and hearing that and saying, that actually sounds pretty reasonable. That's a reasonable reason not to exercise. And then we started to make the connection, like actually in Detroit, there's lots of like 5K runs, 10Ks, the marathon, but a lot of those events are set up for people that look like me, right? Maybe somebody that has experience running or exercising, maybe somebody from the suburbs, not really somebody from Southwest Detroit. And so that was where the idea came from. And what's been awesome is the community really bought in. And so your idea of like nature prescriptions, like I think there's some trust that we have. And so I think that's another really great idea, especially for our community. So I really appreciate that.
Not nature and greenery, but you all do have a indoor track, right? I don't
That
know.
is
Do
great.
people make use of, I imagine if it feels unsafe to go out, that, yeah, are there?
Yeah, no, I appreciate you saying that. That's been another interesting thing. So when the building was made on the second floor, there's a walking track that you can come to. Just to give that, not that gyms are the end all of exercise, but there's actually not one gym in the entire Southwest Detroit community. Either you have to go downtown or you have to go to Dearborn if you want to go, even to like a Planet Fitness. And so the nice thing I can tell you, wintertime is definitely more busy, but there will be many people that will come just to do the walking track. And we have transportation. So if they need transportation to get here to utilize the walking track, we can definitely do that, which we have, which is pretty exciting.
Cool. Future research question. To what extent do you think that initiatives like the prescription food initiatives and other things you're doing might be able to offset other changes to our healthcare system, such as access to healthcare?
Yeah, great question. Complicated, but I think so. I kind of hinted at that before. Is like I think the challenge goes to the priorities of, you know, of course, the main thing in our health system is insurance, right? Like having insurance plays a big role. Unfortunately, as I mentioned, we have 39% of our patients don't have insurance, so we see the challenges that come to health when you don't have insurance. But who's making the decisions of what is being paid for from insurance companies is always interesting to me because, and you hear of this as well. There's a very expensive medications that, sometimes are very much needed that are not paid for, and sometimes there's meds that I think like this medication is expensive, but it is being paid for, and especially if we're thinking about health, and if the investment for an insurance company is we want their clientele to be healthy, and things like food are relatively affordable, don't have side effects, and can make a difference. Like, can we emphasize that more? And so I think that's something that long term I am hopeful will be balanced a little bit better right now because we see this on a day-to-day basis. It's not. And so, but the challenge I've seen so far is that insurance companies have been willing to pay for food in some ways. I've seen this, but usually it's like, oh yeah, we'll cover a fresh prescription program, or we'll do some stuff to help with food insecurity. But it's usually like short term. The programs are not very dynamic, and it's only for their insurance, the people that are part of their insurance. And so I get that, but that's not like the world that I live in. I see anybody that walks in the door, and so yeah, I think there's some steps that we're taking, but we have a long way to go. That's for sure.
All right, we have a research question here about the connection to diabetes that you reported out on. asking about anything that was surprising or maybe to dig into that a little more if there's anything you can
Yeah.
share.
Well, so if you kind of go into, if you look at the data, and this is even just outside of CHASS across the country, there's been some other research that's looked at kind of health outcomes related to these like the fresh prescription program. Oftentimes there'll be fruit and vegetable prescription programs, or you hear them called produce prescription programs. Um, there's been a few things though that I think that have stood out, and I think the data is still has a way to go. Like even our study has lots of limitations. I think we had like 65 participants, both on the control side and then 65 on the experimental side. So still a small study, but if you start to put things together, I think you start seeing that. That I do think there are some variables that seem to benefit more from better nutrition. And so I think if you're somebody that's experiencing diabetes, that seems to be a benefit. Data on like blood pressure control related to nutrition is a little bit more challenging. And I think we even see this outside of nutrition, but just in other ways, even when it comes to medications and other factors. So that I thought was kind of surprising. And so I think when I look at those things, that is like an area to look at. I know that there's been some more data looking at like heart and like cholesterol and lipids, and that seems to be an area that also may have some benefits. We did not see that in another study that we did, but I think that was still pretty small. And so we need more information. There is no doubt about that, and hopefully we'll be able to add on to some of that literature in the future as well.
Great. Well, I'm going to roll out some questions, but folks should keep. I'm seeing here someone saying similar work was done in my neighborhood as a child and it had a big impact on their life. So some of these stories are really important. Let's see. I'm curious if CHASS has developed a process for referring patients with Medicaid to the new in lieu of services, food nutrition services available, some of the Medicaid plans. Maybe that question is that, yeah, you want to share and elaborate on that?
Yeah, absolutely. So the answer is yes. So a couple of things I would throw out in, say that at CHAS we do have a WIC office. So it's kind of the beginning phase, I think, when we talk about nutrition. And we do have a very robust integrative community health worker program, which is really helpful as well. And so typically what happens for myself as a provider, when I am like done with a patient more or less for that clinical visit, then we usually try to connect them to, especially if there's some needs, looking at what options are there, right? Or what are things that are there. So you mentioned some of the governmental programs. Absolutely. That's been something that's there. Although this isn't really about nutrition, but one of our really new ones exciting is for our pregnant women in Detroit. If people are familiar with the RX, I'm drawing a blank, RX Kids program, if I remember. Yeah, from that gives like $500 every month for the first 6 months of life and $1,500 when you're pregnant. Like that's a game changer for many of our pregnant women, which has been incredible. And that just started in January. And so why I'm saying that though is like any program that we can get them set up. And sometimes it's even just like finding food pantries within the neighborhoods in terms of some of the challenges with food insecurity. And so fortunately, I think that's been one of our big strengths is just the team-based approach, especially using community health workers, social workers, just trying to find any of those areas that could benefit our patients is really no stone unturned. I guess I would leave it at that.
Great. Well, and I'll just add a question. It seems from all of the things that you've been sharing that CHASS is a respected community space that people know and trust and can go to. But I'm curious if there's ways that you can talk about how you make sure to center community voices in some of these programs and processes and the community health worker program or the food programs or just any of the stuff that you all are doing at CHASS.
Yeah, I think so. I think that, that's been the benefit of being around for such a long time is like, I think we are always trying to listen, always try to learn. That's of course from like our medical patients, but anybody that's utilizing the center. And then even outside of that is just the partnerships that we've had, whether that's been within Southwest Detroit or throughout Detroit, or even in the state of Michigan, in learning, how we can do things better. Because you see these ebbs and flows, and right now, as I hinted before, it's a really challenging time, especially understanding some of the changes that are going to come to insurance and Medicaid, and how are we going to be able to balance. But I think the fortunate thing, and that's why I kind of put our mission and vision at the beginning. It's very clear of like who we are. We're not going to change that. The equity that we have in our community is so key as well, because we couldn't do anything without the community that we serve. And so I think that whether it's myself or other leaders or Dr. Valbuena, who's our CEO, like all the decisions are being made at CHASS that are really, how do we just sustain this and make sure that we help our community? And I think when you think that way, it makes it more gratifying, but it also allows us to just kind of keep going even in challenging times.
Absolutely. Well, this group is also, because it's the M-LEEaD Center, we focus a lot on environmental health and disparities in environmental health. So I'm just curious too, if you wouldn't mind speaking as we wrap up here, just about sort of how that shows up in the clinic. And I mean, indirectly and directly, you all are working on what I would consider all environmental health issues in some way, shape, or form. But I'm curious to hear
Yeah.
how you all, navigate that.
Well, I think for us at CHASS, there's a couple other areas of being unique. I mentioned kind of the larger immigrant population in Southwest Detroit, but we are also right between the two bridges. We have our bridge of the Ambassador Bridge, and of course this new Gordie Howe Bridge. And so that has been very interesting, I can say, like in terms of, especially when you start looking at health. And I know, some of our awesome CBPR partnerships already are looking at some of the environmental changes related to truck traffic and pollution. And we're already in a very polluted area as it is with many of the factories right here on the river. And so these are things that we see often. I think one of the things, and I was just talking to somebody, some people may be familiar with, there was some flooding in Detroit, in Southwest Detroit over the last couple of years. And I think one of the things that's a challenge, and I think about this from an environmental standpoint, and this doesn't just reflect the flooding, but anything. It's like people are just doing the best they can. So proud of the community that we serve, but like it's a vulnerable population. And so something like a flood or, some other challenge that occurs, just, it's not just that's going to cause so much stress in the community or the families that are there. It really, it makes such a long-term impact. And that's what I think we end up seeing at CHASS. Cause, I remember like stories with the flood of, yeah, I'm already surviving in my house and now it's flooded. And now the city's like, yeah, we're going to get you a hotel while we get this all cleaned up and it was in the winter time, I remember too, in Southfield. That's great. And then, but, oh, guess what? I have 4 dogs. What am I supposed to do with them? Well, we can't bring dogs to the hotel. And so then you're like, oh, geez. So there's like all these steps that it's like one thing becomes 2 things and 3 things. And so that's where, I think from a place like CHASS is trying to think outside the box, any way to help, our patients, whether in this case it's about nutrition, whether it's environmental justice or whatever it can be, I think is really key to who we are.
Yeah, absolutely. Well, any other information folks should know, or if they want to support or they want to get involved, or want to collaborate? It sounds like you all are busy, but anything else you want to share?
Well, once again, Allie, just appreciate all you guys. Appreciate the work that everyone's doing because I know everyone's doing the best that they can, especially understanding your organization. Obviously, Chaz, we're always willing to talk and learn from anybody, collaborate if there's some ideas. And I will give one last plug. Our 14th annual Chaz 5K run, walk, and kids superhero race this year will be on August 8th. And so it is on our website. If you have any questions or want to participate, volunteer, please let us know for sure. It's a fun day.
Does that mean like capes are required for this activity?
Well, they would not be. I've worn, let's see, I was Batman last year and Superman the year before, but
Aw,
that's mostly the kids that I think are doing that. But anyone that wants to dress up is willing.
awesome. Well, we can call it a wrap, and folks can check this out. We're going to have it posted online eventually. But thank you, Dr. Bryce. It was lovely to have you, and this was a great conversation. So much to learn and share. So thank you.
I'm honored. Thank you so much. Have a great day, everyone.
Take care.